Good afternoon. My name is Dr. Nelson, and today I will be hosting the live lecture session today for Professor Flag. So we are already past time, so I'm going to go ahead and get started. So staying in line with the module, I'm currently going to touch on Chapter 4, the government payer types. So the main objective for this lecture will be to understand the history and the differences in the Medicare and Medicaid programs, to understand the government programs offered outside of the Medicare and Medicaid programs, to differentiate between TRICARE and CHAMPFA programs provided by military personnel and their families, and to differentiate between the various government-sponsored healthcare plans and understand how these plans interact with and impact the healthcare system in the United States. So let's first touch on the history of Medicare. So Medicare originated from Title 18 of the Social Security Act. It was originally designed as the health insurance for the aged and the disabled. Medicare legislation provided health insurance for people over the age of 65, and it basically evolved to cover beneficiaries that were entitled to Social Security or railroad disability, or those with end-stage renal disease and ALS. So plans in addition to Medicare Part A and Medicare Part B. There's also Medicare Part C, and this is sometimes called the Medicare Advantage program. There's also Medicare Part D, a prescription drug benefit for the Medicare beneficiary, covered drugs that were not covered by Part A and B. And this plan was designed to assist with coverage of prescription medication for the Medicare beneficiary. Medicare Part A is considered a hospital insurance plan. It's a premium-free plan. So an individual can be covered based on his or her earnings or earnings from a spouse, a parent, or a child. The age requirement is 65 years or older, but people can apply for Medicare Part A when they are 6 months away from their 65th birthday. Individuals with disabilities need to be on Social Security or railroad retirement benefits for at least 24 months. Medicaid Part A covers inpatient hospital care, skilled nursing facilities, long-term care hospitals, hospice, and home health. Coverage under Part A, in 2008, they paid off over $232 billion for about 45 million beneficiaries. The Part A services for inpatient hospital care, skilled nursing facility, long-term care hospitals, hospice, and home health care, as previously mentioned. So for the Medicare Part A costs, this includes a deductible for each benefit period of $1,316. For days 1 to 60, there's a $0 coinsurance for each benefit period. For days 61 to 90, $335 coinsurance per day of each benefit period. For days 91 and beyond, there's $670 coinsurance for each lifetime reserve day. So after day 90 of each benefit period, which will not to exceed 60 days over a beneficiary's lifetime. Beyond lifetime reserve days, all costs will fall on the beneficiary. For inpatient hospital coverage, this is basically defined as a person that has been admitted to a hospital for bed occupancy purposes and is receiving hospital services. The beneficiary will stay at least overnight or be transferred to another facility. Factors when admitting include severity of signs and symptoms, probability of something adverse happening, or the need for diagnostic procedures. Managed by unlimited benefit periods, the time from the discharge to the next admission needs to be at least 60 consecutive days. The total number of days in the benefit period is limited to 90 days. The patient has a pool of 60 additional days that Medicare provides of inpatient care during a benefit period. Some covered items are room and board, nursing services, support services, which can include social work, drugs and biologicals, blood products, and supplies. With skilled nursing facilities, these are also covered under Medicare Part A. So some of the services that will be covered include semi-private room, meals, physical therapy, skilled nursing care, occupational therapy, and speech language therapy. So beneficiaries are limited to 100 days per benefit period. Beneficiaries may be responsible for co-payment for days 21 to 100. If a patient does not require a skilled level of care, Medicare will not pay for the visit. A patient can be eligible for home health services under both Medicare Part A and Part B. To qualify, the physician needs to attest that the patient needs care and is homebound. A patient is considered homebound even if they are receiving medical care in an adult daycare center, outpatient kidney dialysis, outpatient chemotherapy, or radiation therapy. The plan of care is for a 60-day period. Under the home health care, some services that are offered: skilled nursing, home health aid, physical therapy, occupational therapy, speech therapy, medical social services. So to initiate these services, a physician's order is needed. The plan of care will outline the care which is needed for the 60 days. There are payment adjustments such as low utilization payment adjustment for 4 or fewer visits paid by the discipline. There's a partial episode payment, which is an adjustment is made when a beneficiary elects a transfer or returns to the same agency during the 60-day episode. And of course, durable medical equipment, which is supplied by a separate provider. Hospice is a benefit under the Medicare Part A hospital insurance program. The beneficiary must be entitled to Medicare Part A. They must be certified as terminally ill, and this is where the life expectancy of the patient is 6 months or less. The beneficiary must elect hospice to receive care during the first 90 days. There is no limit as to the number of benefit periods a beneficiary can have on hospice. If a patient requires a hospitalization that is not related to the terminal diagnosis, Medicare will pay for the admission or treatment. With recertification, the first 90 days require written certification no earlier than 15 days prior to the start of care and no later than 2 days after the start of care. Certification must be on file prior to submitting a claim. Prior to the third benefit period, the hospice physician or hospice nurse must do a face-to-face encounter before beginning the start of the third benefit period. For place of service, this is generally in a patient's home, but it can also be in a skilled nursing facility or a short-term hospital unit. Some of the services that are covered includes doctor services, nursing care, medical equipment and supplies, drugs related to symptom control and or pain relief, home health aid, and homemaker services, physical therapy, occupational therapy, speech language therapy, social work, dietary counseling, grief and loss counseling, a short-term inpatient care for symptom and pain management, and any other Medicare covered service which is needed to manage the pain of the patient. The cost for the beneficiary is $0 for hospice care. Various co-payments for prescription drugs cannot exceed $5. And they're also allotted up to 5% for respite care. When looking at renal dialysis centers, we're looking at the cause of end-stage renal disease. And this occurs from the destruction of normal kidney tissues over a long period of time. This is typically covered under Medicare Part A and is usually within an outpatient setting. It can also be covered in an inpatient setting, but it has to be episodic dialysis and short-term dialysis. Medicare Part A is financed through payroll contributions paid by employees, employers, self-employed persons, or funds that are deposited in the Federal Hospital Trust Fund and used only for Medicare Part A insurance benefits and administrative expenses. For federal, state, and local employees that do not pay the full FICA tax, they must pay the Medicare Part A premium portion themselves. Medicare Part B. Now, this is defined and considered a supplemental medical insurance plan. Premiums are required to be paid by the beneficiary. Coverage includes drugs and biologicals that are not usually self-administered by the patient, hospital services, incident to physician services, diagnostic services in outpatient settings, and diagnostic in nature. So part of the coverage of Medicare Part B can include physician services, nurse practitioners, physician assistant services, nurses and midwives, psychologists, preventative screenings for services such as prostate cancer, glaucoma, mammography, and there are other services that are also covered under Part B. Diagnostic x-rays, surgical dressings and splints, ambulance services, and prosthetic and orthotic devices, excluding dental. Medicare Part B is financed by monthly premiums from the beneficiary. It's a voluntary program, and premiums are deposited in a separate account known as the Federal Supplemental Medical Trust Fund. The money from this program pays Part B benefits and administrative expenses. Medicare Part C, which is also known as the Medicare Advantage Plan. Part C plans are in place of Medicare Part A and Part B. It is offered by private insurance companies and excludes hospice. Some extra benefits, which may also be offered with this plan, is dental, vision, and hearing. Some characteristics of Medicare Part C includes coordinated plans through health maintenance organizations or HMOs, provider-sponsored organizations. It's generally offered as part of a network. So if it's in network, there's a lower out-of-pocket expense, as opposed to if it's out of network, there will be a higher out-of-pocket expense. Private fee-for-service plans don't have provider networks, so it is the freedom of choice for the beneficiary. Medicare Part B initially started, Part D, sorry, initially started out as a prescription discount drug plan, but it has since transitioned into a plan that subsidizes prescription drug coverage. It's voluntary and includes most FDS-approved medications and biologicals. Medigap is a coverage for services which are not covered by Part A or Part B. So now we're going to jump over to Medicaid. So looking at the history of Medicaid, a federal and state program that basically came out of the Title IX Social Security Act. It pays for medical assistance for individuals with low income. It's jointly funded by the federal and the state, and its main purpose was to assist in supplying medical coverage for people who are in need and eligible for the program. Medicaid at the state level. At this level, the federal government established the guidelines through statutes, regulations, policies, and procedures. Each state can come up with its own standards in regards to eligibility, scope of services that will be provided, duration of services, the payment or fee schedules, and its own administrator. Each state basically structures their program differently. So there are a minimum set of guidelines, but outside of this, each state can look different in regards to coverage and eligibility. Looking at the scope of Medicaid services, each state receives funding from the federal government, but the state needs to provide basic coverage to the neediest populations. Mandatory services must include inpatient hospital services, outpatient hospital services, pregnancy-related services, nursing facilities, rural health clinic, home health care, labs and x-rays, pediatric and nurse practitioner services, nurses and midwives, federally qualified health center services, ambulatory services, screening and diagnostics and treatment. So there are also optional services that can be provided for which states will receive matching funds if they provide diagnostic services, clinic services, intermediate care facilities for individuals with intellectual disabilities, prosthetic devices, prescription drugs, optometrist services and eyeglasses, nursing facility for children under the age of 21, and transportation. So with the duration and payment for Medicaid services, each individual state can determine the duration of services offered. There is a limit as to the amount of restrictions imposed on the beneficiaries. The payment can be fee for service or an HMO style plan, but payment levels to the providers are set by the individual state. The payment level must be high enough to attract enough providers to facilitate care. Payment for services is considered as payment in full. So states can impose coinsurance, deductibles, and copayments. But states cannot impose cost sharing for the following services: for pregnant women, children under the age of 18, hospital or nursing home patients, emergency services, family planning services. So Medicare and beneficiaries may be eligible for Medicaid in addition to Medicare. Medicare is considered a primary payer, while Medicaid is considered a secondary payer. Medicaid is always considered the payer of last resort. The Medicaid program will not make a secondary coverage payment if the amount paid to the provider is greater than the allowable for the state Medicaid program. So no payment will be made by Medicaid. The Children's Health Insurance Program, or CHIP, was initiated in 2009 as part of the Balanced Budget Act of 1997. So this was another type of coverage that provided $40 billion in federal funding to be used to provide health care to low-income children. And this was generally for those below the 200% of the federal poverty line and those who do not qualify for Medicaid and would otherwise be uninsured. Medicaid does not provide medical coverage for all persons who are poor. Income is only one test for Medicaid eligibility. Additional services, sometimes called state-only. Money is put aside to provide assistance to those who do not qualify for Medicaid. So there is a medically needy option. Coverage can begin as soon as 3 months prior to the application date. They can drop coverage at any time during the month if they no longer meet the criteria. Coverage will end on the last day of the month. Another type of coverage is programs of all-inclusive care for the elderly, or PACE. This is a managed care benefit for the elderly. It features a comprehensive medical and social service delivery system. It utilizes an interdisciplinary team approach, and for eligibility, you must be 55 or older, meet a nursing facility level of care, and live within the network service area. Some of the services that are provided include social work, prescription drug coverage, nursing facility care, primary care, restorative therapies, personal care, hospice, nutritional counseling, meals, and mental health services. There's also the temporary and needy families, which replaced aid to families with dependent children. It provides states with money to help low-income families with case assistance. This is a benefit that many do not know that they may qualify for. TRICARE is also a comprehensive and affordable healthcare coverage for active duty service members. This is also available for those in the National Guard. TRICARE Prime is a managed care option offered by the Department of Defense. This plan offers the most affordable and comprehensive coverage for its beneficiaries. Coverage includes, but not limited to, outpatient visits, preventative care, hospitalization, maternity care, mental health, prescription drug. The member is assigned a primary care manager, and there is no out-of-pocket cost for the beneficiary or their family. There's also TRICARE Standard and Extra. So this is a fee-for-service plan that's available to non-active duty personnel. It provides the same coverage as TRICARE Prime. There's in-network and out-of-network benefits, and the out-of-pocket cost for the beneficiary after meeting annual deductible. TRICARE for Life is a secondary coverage for all Medicare age beneficiaries that have Medicare Part A and Part B. This coverage is available worldwide. TRICARE is the primary payer and Medicare is a secondary. TRICARE for Life will pay all co-insurance for TRICARE covered services. For services covered by Medicare and not TRICARE, Medicare will only pay 80% and the beneficiary will pay 20%. Another type of coverage is CHAMPFA. This is the Civilian Health and Medical Program of the Department of Veterans Affairs. CHAMPFA is a comprehensive healthcare program where the Veteran Affairs shares in the cost of care for covered services. CHAMPFA is a Department of Veterans Affairs program, and TRICARE is for active and retired members. Eligibility is for beneficiaries that are spouse or child of a veteran who is permanently or totally disabled, or someone who died from a VA-related service or connected disability. Workers' compensation. These benefits are made available to employees to help cover healthcare costs due to a work-related injury. Federal government employees are covered under the Federal Employees Compensation Act. And last but not least, there's the Indian Health Services. The IHS provides healthcare services to the American Indians and Alaska Natives. They provide comprehensive, culturally acceptable, personal, and public healthcare services. So this will conclude the presentation for tonight. If we don't have any additional questions or comments. If not, thank you for attending and have a good night.